Hello, my name is Mark Livingston, and I'm the chairman of the Department of Advanced General Dentistry. I'd like to talk to you about our expansion request and why it's important. Why expand? First of all, we're seeing an increased demand for our dental services from our medical colleagues for their patients. Why, you might ask? Because medical science continues to evolve, revealing associations between our overall health and dental health. Let's look at some examples. Patients receiving chemotherapy at our Cancer Institute have a potentially suppressed immune system. So something like a dental abscess could cause their chemotherapy to be suspended until this dental problem is addressed, thereby elongating their cancer therapy for an unnecessary reason. Transplant patients. First, transplant patients should have their acute dental needs addressed before even being placed on a transplant list. Secondly, upon receiving their new organ, they're given drugs to suppress their immune system to prevent rejection of the new organ. By having such a suppressed immune system, something like a dental abscess could put the new organ at risk, causing horrible complications for these patients. Third, cardiothoracic surgery patients. Patients who receive new heart valves are at risk. Should they acquire a dental infection that becomes blood-borne, this infection, once in the bloodstream, could infect those new valves and cause them to be lost, thereby causing severe hardship for these patients and potentially a second heart valve surgery. The thing we should take away from this chart is the following. If we look at our carrying capacity as it stands currently and the anticipated referrals from our medical colleagues, our current system cannot absorb the extra number of patients, and expansion is a must. What are the benefits to the University of Mississippi Medical Center? First, patients' dental care is performed at an expedited rate for the at-risk patients, thereby getting them to their medical care as soon as possible. Secondly, a reduction in dental complications, which results in fewer treatment delays, making our medical colleagues more productive and more efficient. Also, fewer unplanned admissions to our hospitals. Next, the potential for improved outcomes across the board for all practitioners at the university. UMMC would be the only healthcare system in the state with this level of care located directly on campus. Also, it would be a hedge against decreased reimbursement from Medicare. Complications and unplanned hospital admissions can reduce a hospital's Medicare score. Medicare can reduce their payments to hospitals by up to 2% if their score falls enough. Let's look at our personnel request and the associated cost. As you can see, we're asking for 3 additional faculty, but no additional residents. Why? This is a complex patient pool, and novice practitioners such as residents are not ready to treat these patients at this level without oversight. So what we need more than new residents are additional faculty. Also, we're asking for 4 additional dental assistants, another dental hygienist, an administrative assistant, and a patient navigator to help us move these patients through the system efficiently. We can assume 28% in addition to their salary for benefits for a total personnel cost of $899,000. As a final thought, I'd like to leave this question for you to consider. What is best for our patients? Thank you for your time.